Hello and welcome to Everyday Medicine. I'm Dr. Luke and I'd like to thank you for joining me on this podcast series where we share conversations with colleagues exploring their special interests in medicine and bringing insights, ideas and advice which I hope will be applicable for our medical practices. In this episode, we're talking with a nursing sister and philanthropist about medical outreach programs. Before joining her, for Australian audiences, listening does give you eligibility for your CPD, so log in and add this as an activity. You may also consider journaling, reflection, and adding to the review and performance section in your CPD. Well, Sister Jodie Manssen is not only an expert ICU and emergency nurse, but also an adventurer and philanthropist. In 2023, she self-funded and volunteered her services to TrekMedic, sacrificing the security and financial rewards of a job and devoting over 2 months of her time and expertise during their annual trip to Nepal. TrekMedic is based in Melbourne. It's a non-profit team of volunteer doctors, nurses and allied health professionals who have come together to help provide basic healthcare, education and emergency aid to underprivileged communities worldwide. The trip Jodie participated in between September and October 2023 treated 1,698 patients across 5 remote villages, including over 300 dental extractions and fillings and managing trauma, hypertension, diabetes, lesions requiring excision, and assisting with a multitude of eye and ear complaints, as well as infectious diseases and rheumatologic disorders. TrekMedic donated over 400 pairs of glasses and had to deal with monsoon rains, crazy narrow roads and goat paths, insect and leech bites, as well as altitude in delivering their amazing outcomes to the local villagers. When Jodie casually mentioned her trip, I had to learn more and share the experience through the podcast. And Jodie is currently working with First Nations people in Alice Springs, as well as the local community there, and will soon be travelling to New Zealand to attend to ski, snowboard and mountain trauma in their winter season. Please welcome Jodie Manssen to the podcast. Jodie Manssen, welcome to Everyday Medicine. Thank you for joining me from the Red Centre from Alice Springs. I really appreciate you making the time, Jodie. And we're going to be talking a little bit about your involvement in outreach programs as a nurse. And, you know, we're all very, very proud of what you've been doing. Right now, you're working in ICU in Alice, and I want to talk with you about that a little bit too. Could you share the experience? But can you tell us, Jodie, a little bit about your, how you got here, your journey? When I first met you was with my son. I saw you on a bicycle. You were going along the Bass Coast Trail down near Envelope on Thaggy there. You look very fit, Jodie. We shared, I think, a little bit of breakfast, which was really nice. And then you were going to come surfing, but I think you got caught up with other nursing activities. So I know you're a very fit outdoors person, which we all admire. How did you get into nursing? And just tell us a little bit about your journey here.
Oh, hi, Luca. It's really a pleasure to be a part of your podcast. So I'm 33 years old and originally from Brisbane, Australia. I've been a nurse since 2011. I've worked nearly all my career in critical care, so emergency and intensive care. I sort of started off in a tertiary hospital in Brisbane, and then I've spent the past few years travel nursing around Australia, which has been a really cool way to sort of explore, meet new people, and I've been working in some more regional and remote hospitals. So definitely had some more exposure there. Met your son Roland down in Victoria in a little hospital called Thaggy, which was just awesome. The Bass Coast is beautiful. I hadn't been down to that part of Australia at all, so that was really cool. And I've circled back to the Red Centre, Alice Springs again.
I get the feeling, Jodie, you like to search out some challenges, by going to rural areas and more remote areas, which is not an easy thing. Like, you have to adapt, you have to break away from the sort of the common and we all get attached to things, routines that we feel comfortable with. And it's a credit to you that you've pushed yourself and gone to lots of other places. And I'm sure if there are nurses listening to this, they might be inspired by what you've done. You were after working in Victoria, you were drawn to this outreach program in Nepal. Like, what attracted you to that? I'd like to just talk with you a little bit about that, because other people might be interested, myself included. Like, how did you get involved with that?
Absolutely. I've always, it's been a lifelong dream that I've always wanted to do some volunteer work. Wasn't too sure how, when, or, sort of how I'd go about that. I actually went to work one day in Montague, and a colleague sort of said to me, "Oh, what are your plans? Have you heard about TrekMedic, which is a small non-profit organisation that is leaving from Melbourne to go to Nepal?" And I was like, "No, I've not heard of them before." And he said, "Oh, you trek village to village with a group of volunteers, and you provide medical treatment, and you sort of trek through the Himalayas every few days, providing healthcare." And I just thought that sounded absolutely perfect. I'd actually been in Nepal the year before doing the Annapurna circuit, so I was well aware of what I was getting myself into. Yeah, and I just really have always loved the idea of doing some healthcare work in some remote areas, and sort of seeing how they live and manage and work with a diverse team of skill from everywhere in the world.
So you applied at TrekMedic. Were there interviews? Was it quite an extensive set of interviews that you had to undertake before they said, "Oh, yeah, I think you're okay, you'll cope, you're tough"? Because it would be quite unfair. Like, how rigorous was that interview process?
It was pretty smooth, to be honest. It was a face-to-face Zoom meeting with one of the organisers. So they run 2 trips every year. So one of the doctors from Melbourne, John, he Zoom interviewed me. Yeah, and so we sort of chatted for about 15 minutes and got to know each other. And I'd explained that I'd already been up in the Himalayas the year before. So I thought that I'd be fit enough to join the crew, and just sort of explained what my background was and how I thought I'd be, contribute well towards a team.
Did you take your snowboard with you? Showing you you love snow.
No, I wish. I looked at all the peaks and was looking at what I could do.
So what sort of training did they ask of you? Was it just, well, I'm a nurse in critical care, this is my background, I'm credentialed already in all these, nursing matters, and that was enough? Or was it, you need to also do a bit more study because you're at altitude, you've got a third world or an emerging economy, I suppose?
We definitely ran through earthquake and altitude sickness, earthquake protocols before we left. We did experience some earthquakes when we were over there. We sort of touched on what the common presentations were in those remote areas, and sort of the basics on how to treat. We did some, we were actually doing just out of Melbourne, there is some stairs, I can't remember what it's called, and we were doing training up.
1,000 steps.
Yeah, that's it.
Steps.
So we met there a few times. We would take 10-kilo weight packs and we'd be heading up there. We did that a few times. Just general fitness, and also having sort of a background in ED, we sort of is very helpful for being a bit more adaptive in different environments, and being able to treat basic conditions as well, sort of GP presentations, basic stuff like that.
So who were you there with? Can you describe the team of people? Like who was there? How many of you? And roughly what were their backgrounds?
Yeah, so our team consisted of 15 members. So we had 9 medical professionals. Which was 1 Nepalese dentist. We had 4 doctors, so a Turkish lady, Nepali man, and 2 Aussies. And then we had 4 nurses. So we had 3 Aussies and 1 was from the UK. And then the TrekMedic was organised and supported by Himalayas Hikers Expedition. They're an organisation in Kathmandu that sort of do hiking and all that sort of stuff. So we had 4 Nepalese guides who also helped us with translation from Nepalese to English. We had 2 chefs that cooked our meals 3 times a day, which was amazing.
I thought it was supposed to be harsh.
We got fed very, very well. And we also had a couple of porters that were carrying our medical supplies from village to village. So
I was going to ask you, so you're walking, you're trekking in between the villages because there's no possibility of a truck or a car. It's not that kind of terrain, so it's quite remote. Is TrekMedic an Australian or an international company?
Yeah, Australian, I believe. It's based out of Melbourne.
Okay. What about the medications you were taking? So who was providing those? And did you have a large, like an esky full of a whole range of things like metronidazole and all the other various drugs that you might need? Or how were you sort of supplied with all those sorts of products?
So we sort of took a feel like about half the medications with us, and sort of medical supplies that we didn't think we could get in Kathmandu. And then when we got there, we were able to buy sort of bulk paracetamol, Nurofen, Keflex, all the basic antibiotics that we needed, gauze, syringes. Oh, we did take quite a bit of that ourselves, actually. So we would sort of collect or get donated expired products and medical supplies, so I took over a very large suitcase. Half of it was medical supplies and half of it was my trekking gear. So yeah, we were very fortunate when we got there. We had good contacts that were able to source us what we needed. So the week leading up to the trek, when we got to Kathmandu, it was just a week of prepping, getting everything together, team building, and then we set off the next week.
Okay, so the products that you have that were donated, were they donated from hospitals? It takes a lot of organising, doesn't it, to clear this with authorities because something might be about to go out of date, or I think most of us think, well, it's actually probably still quite okay. But was it difficult was that something that, like we mentioned John Lee, who's a very liked and appreciated A&E physician here in Melbourne, was he sort of behind trying to get some of these products from various health organisations, or do you know how those products were sourced?
The medications?
Yeah, medications and things that were sort of just going out of date.
They were just donated, honestly, I think, by people from the hospitals or small clinics that weren't sort of using them up quick enough.
Yes.
We just over the years, I think John's got a bit of a storage place at his house, and he's been collecting gear as he goes. So everyone's been very, very generous. We sort of managed to rustle together all the medical supplies that we needed.
So you head off. You've got 3 chefs. You've got Shannon Bennett there, inspired dining. You've got a group of Sherpas, a sturdy pair of sand shoes or walking boots, and away you go. And tell us all about the sort of people that you were meeting there, the patients that you were treating. The main conditions that we were seeing was sort of viral fevers, hypertension, arthritis, reflux, some pelvic inflammatory disease, pterygium, so that sort of abnormal growth over the eyes from sun exposure. We were sort of assisting the dentist with a lot of fillings and teeth extractions. Right.
She seemed to pull the highest numbers through that clinic. Lots of
dental. Yeah, so dental work was. Are they? I guess there's no fluoridation of water, and I wonder what the general kind of promotion of dental care is like there. Do you think? Did you get a sense that people perhaps aren't aware of the need to floss and brush teeth and maintain dental hygiene?
Absolutely. I think it comes back to sort of lack of knowledge and
education.
That's the need for education, yes, yeah.
So dental work was big. Was there? I imagine there might have been some difficult obstetric type cases. Or is that something that your team was involved with, or not really? That was for a different group of people. Yeah.
Yeah, we did run into. I think we did see a few pregnant women, but no obstetric issues at all.
Yes.
Yeah.
And Fred Hollows was instrumental in his work with vision impaired cataract trouble patients through Africa, and set up that incredible foundation. And you talked about pterygiums and perhaps the lack of sunglasses from the exposure there. Was there a lot of? You didn't have an ophthalmologist with you specifically, did you, or did you?
No, we were the ophthalmologists.
You were the ophthalmologist. So would that have been everything if you had someone there that was able to conduct? Again, I don't know whether they would have in the field done a cataract extraction or whatever, but would that have been a very helpful addition to your party if you'd had an ophthalmologist?
Absolutely. We did talk about that. An ophthalmologist would be very good to have on the team. We kind of, most things we were able to do was sort of use the Snellen chart, which is an app that's on the Samsung phone that uses shapes as opposed to letters, just because a lot of the remote communities are illiterate. So we would go through the Snellen chart with them. It was a very fun way to sort of learn the Nepalese language, because you get quite used to it pretty quick. And it was definitely a rewarding part. So some of the patients were up to 80 years old, had sort of 20 on to 400 vision, and we'd put glasses on them and they would have nearly 20/20 vision afterwards.
Yes.
And the just that was the most rewarding part, I think, was seeing their face light up, and they could sort of see things a bit clearer, and they were absolutely stoked.
That would have made a massive difference. Were there lots of soft tissue injuries, people falling, fractures? Did you have to manage those sorts of things? Were people being brought in with those sorts of issues?
Yep. There was a lady who presented. She told us she'd been dragged by a buffalo for 100 meters the week before, and she was so stoic. She was about 7 years old, and she was in so much pain. She had C-spine tenderness, probable fractured ribs, shoulder pain, and a headache. She was still walking around, and we actually got the Nepalese guides to translate that a couple of times, because we're like, surely she hasn't been dragged by a buffalo, but she had. That was interesting. And then another lady who had fallen into a river and had a head strike, and she had developed subcutaneous emphysema under the eye socket. So I mean, we're so far out. We're 12 hours from Kathmandu by bus.
Did you have the facility for intravenous administration of antibiotic therapy, and a bit of wound debridement,
yes,
all those sorts of things, suturing and so forth? You could do all that. Could you set fractures? Were you able to set a fracture if you saw a fracture?
No, we didn't have any plastering equipment with us, but we did have sutures, IV access, antibiotics, which we did use a couple of times. I remember we had one lady who sort of had a septic picture. We weren't too sure what the cause was, but she was tachycardic, hypotensive, febrile. So we dosed her up with some IVs and then gave her some orals after that.
If you had patients that you thought were a bit beyond the services you could offer, that perhaps in Australia you might have been calling an air ambulance. We've got these luxurious ways of moving people around in this country, haven't we, in other Western countries? Like, how would you, if you had such a case, was there any facility for getting that person down to Kathmandu, where there are more major hospital services available?
There is the best method would either be via air, but they just don't have the money to sort of afford that, or 12 hours by bus, which we did have a couple of cases that we strongly recommended that they should go to Kathmandu to get follow-up. But because of lack of sort of understanding and insight, we would try to explain and translate into Nepalese how important the situation was. We weren't sure if they quite grasped what we were trying to say. Money was a big factor as well, and sort of them not wanting to leave their families to put their health first.
If they did go to Kathmandu, was that health service provided by the government? Was that free, or is
I don't believe so. I think it is out of pocket, is my understanding, which makes it very expensive.
Were the dialect differences as well? You had Sherpas and people that could interpret. Were they able to communicate very easily with people that were in the more remote areas that you were going to?
There definitely was different dialects through the remote communities, because sometimes the Nepalese translators would sort of struggle to figure out what some of the patients were saying. So I think slight change from community to community. But all in all, we were able to sort of figure out. We certainly learned what the word duksha is. That's pain. So we learned some basic.
Duksha. What about dangers? I imagine it would have been cold. It was physically demanding. You might have been exposed to various gastrointestinal pathogens like Giardiasis, so forth. Was that being robbed, perhaps? Here's a group of international people maybe perceived as having some wealth. Were the issues that like arose in that regard?
We did have a few hiccups along the way. So I guess first of all, heading out on the 12-hour bus ride, we blew one tyre in the dark. So we drove for probably another 10 minutes, I think, before we finally pulled over. And we changed the tyre, and then after that, I think we're about 1 hour out from the final destination, and we had what felt like 2 near rollovers. One of the girls actually got out and walked for a bit. So it was a very bumpy bus ride on the way. We had cold and flu go through about 90% of the team, which wiped people out for a couple of days at a time. I think it was just myself and one other nurse that were lucky enough to avoid it.
That comes from working in AME. You're exposed to every forest known to mankind.
Yeah, I guess so. Yeah. We had one of our doctors sustained a leg injury while we were hiking. Yeah, which sort of made things a bit hard for her. But and we had one of our dentists unfortunately had her phone stolen when we got to the final village,
Okay.
which
Yeah.
was a bit sad. But
What about your own personal safety?
being predominant.
Your own personal safety, was that something that, was ever questioned? I imagine, attractive, European females there. Well, that wasn't an issue at all for you?
No, never. We never ever felt unsafe at all at any stage.
Right.
No. Yeah, Nepal's a safe country. We always felt very safe there.
So just like in a few sentences, what would you say you've learned from that experience? You were there for a couple of months, I think, too, weren't you? I didn't ask you that, actually. It was quite a long stint. It's a very big sacrifice of your personal time, but that was a few months. What have you learned from that?
I learnt so much going on the volunteer trip. I sort of learnt how little these remote Nepalese communities have, but how kind and generous and loving they are. And sort of, yeah, that exposure sort of makes you truly appreciate how good our healthcare system in Australia is as well. And what we take for granted, some really simple conditions that they have or diseases that would be so easily fixed and treated in Australia just goes on over there, and it's quite sad to see. You know that it can be fixed so easily, but you're out there with not a lot, so it's a bit sad. But yeah, it was just amazing. I learnt a lot from the trip.
Would you recommend it to who would you recommend it to? Someone was looking for a challenge, and who should put their hand up and think, oh, okay, that's great. I'm inspired by that story because it does sound amazing.
Yeah, it was very emotionally and physically challenging. Some days we cried, some days we laughed. We spent a lot of times playing with the kids, blowing bubbles and giving them stickers and having a good time. So it was an emotional roller coaster. But I would do it all again. It was just incredible. Anyone who sort of is up for a challenge, wants to sort of see very remote Nepal, have a good look at the Himalayas as you're trekking by. They're absolutely stunning peaks. And yeah, just seeing sort of firsthand how those remote communities cope. Yeah, and sort of the conditions that they're exposed to that we don't often see in Australia.
Yeah, it opens up the soul, doesn't it, when you do go to second and third world countries and you suddenly realise, I know I was quite shocked, places I've visited, and you all of a sudden realise how lucky you are, how unfortunate other people are, and how love and kindness and generosity can make a very big difference in the simplest things sometimes. I was going to ask you briefly also about that earthquake. There were reports of earthquakes. Were you there during that earthquake? Tremors, yeah.
Yeah, there was one that occurred, I think maybe 100 k's west of where we were. I can't quite remember off the top of my head. That caused, I think a few people died in that earthquake. And then about a month later, I was still in Nepal and we got hit by, I think it was a 5.7 earthquake, and 200 people passed away from that. I might have been in Nepal when we had a total of 3. Yes.
So there's lots of dangers, some that cannot be predicted. How would people donate to TrekMedic? How would we, if we wanted to donate whatever product we thought might be useful, antibiotics or dressings, how would we go about that?
Yeah, so you can definitely contact the organisation quite easily, and they are willing to accept, financial donations, and any products sort of out of date or in date materials are very useful for us. So it's very easy. I can include some contacts.
It's just like TrekMedic.com. Okay.
Yeah, there's also a really great Instagram page if you just type in TrekMedic, and they sort of post throughout the trip every couple of days. Whoever's leading it will post a little summary of pictures and what we're doing and where we are. So it's kind of gives you a little basis of what we do.
Well, Jodie, thank you very much for your experience and your amazing contribution. I want to ask you a bit about Alice Springs, but I'm going to say thank you very much for making that contribution and, opening up your heart and soul to those people. It's a lovely kind of example for us to think about and follow. You're now working in Alice, like a very different situation. You've gone from the lofty heights of the Himalayas to, the Red Sando, and it's flat. Well, I mean, you've got the McDonnell Ranges there, haven't you, and some beautiful formations, and the land is sort of folded into different hills and valleys and so forth. But you've got a different kind of set of issues here that you're also throwing yourself into, which is, I suppose, to some degree with Indigenous health, and I don't want to touch on it too much, but like, what do you see are the challenges there in the Red Sando? Can you name a few challenges that you're maybe seeing?
Yeah. So I guess we see a lot of factors contributing to poor health. So overcrowded living spaces, lack of resources, and funding, very complex social issues. Also, a lack of access to resources. So when we have big rains here and it floods, it's unfortunate for some of the patients. They can't get on a bush bus and get through to dialysis for the day or even a few days at a time. So missed dialysis can lead to, all sorts of complications that can be quite tragic if they don't get that in time. So some of it's out of their control. We see a lot of late presentations of sepsis and chronic wounds, severe respiratory failure, some road traumas, out here we sort of find family and cultural practices are often prioritised over health, which delays presentations to hospital causes sort of a lot of problems there.
I think, sometimes in health, when you look at it, and of course I don't have an experience with what you've just shared, but just in the sort of more metropolitan regions, we're seeing patients who've got metabolic syndromes and they've got a whole range of physical conditions, and we're always treating them at the end when the problem has presented, and we really want to change that around, and we want to be proactive and try and provide education and help people develop healthy lifestyles and make healthy choices and get into controlling their lipids and blood pressure early before heart disease develops and so forth and so forth. And I feel like a lot of the time in medicine we're always just tackling it at the kind of the wrong end of the spectrum. And Peter Attia's written a book called Outlive. He talks about that quite a lot. And I guess it's not for us to talk about, how do we make social changes, but there you are, you're working in intensive care and, with complex communities, cultures that are, a bit different to the ones probably most of us understand. And we're treating people who are coming in with very difficult issues, and we're patching them up and we're pushing them back out again and, just waiting for them to represent. And it would just be so nice if we somehow had health policies that allowed us to, intervene, educate, support, get people kind of, recognising the things that, this is right across the spectrum, no matter what culture is, to recognise the sort of things that we all should do to maintain health. And because if we're healthy, we're going to enjoy our life much more. We can, as you have, you're healthy, you make wonderful contributions to other people. Where are you going from here? You're looking at leaving Australia, which is going to be sad for us. Jodie, where are you taking your expertise to? Give us a little nibble at the future. Where are you?
I'm heading over to the land of the long white cloud. So they call it New Zealand.
New Zealand, yeah.
So the next move, I'll be spending the winter in Queenstown.
Yeah, it's going to be really tough. Yes.
Yeah, it's going to be a tough life. It's been a dream for a long time, and it's finally happening. So I landed a role as a nurse in one of the clinics on the hill, and I'll do that for the winter, and I don't know what will happen after that. We'll see.
Yeah, that's nice. You'll be eating lots of fur burgers and treating Aussies with broken femurs and whatever, collarbones.
Yeah.
Jodie, so nice to hear and experience. Thank you very much. I'll put a little addendum about TrekMedic in our show notes, so people can look at that and, maybe get some further insights into how we can all contribute in the way you have. Thank you very much, Jodie, for sharing it. It's been so nice talking to you, and all the very best there in Alice Springs and at Queenstown.
Thank you very much. Thanks, Luke.
Thank you.
I hope you enjoyed the conversation with Jodie as much as I did. The abundant goodwill of people like Jodie and the TrekMedic organisation is uplifting, and it perhaps spurs us all to think about better ways in which we can help our community and those that are less privileged. Donations of sunglasses and other medical products to TrekMedic will be warmly received. Well, during the podcast series, we will be covering a wide range of topics across many specialty interests. The discussions are not intended as specific medical advice for patients, but as general information only, and reflect the opinions of the guests interviewed. Requests for new topics to be reviewed and comments about the conversation you've listened to are welcomed, and may be emailed to manager@gihealth.com.au.